my Yomp or yawn lecture. So the idea of yomping being sort of like you're stuck in the wilderness and it's cold and it's wet and it's just like you've got to slog it out, and the idea of yawning, which I'm sure you all get without me having to explain it. So essentially what I'm interested in is the fact that often systematic reviews are these massive pieces of work. Anyone who's ever done it as a researcher knows they're massive pieces of work. And the thing is that unfortunately, because they're massive pieces of work, I think what often happens is when people write them up for publication, particularly when they're Cochrane systematic reviews, they are massive pieces of work to read, and that can be a bit of a hard slog, or it can be an absolute yawn. So basically, I have things that I think of when I'm talking to people about systematic reviews. I say you want to avoid that sense of hard slog unless it's going to be worth it. And you want to avoid the sense of the yawn because you've switched off by the time you get to the key messages and it's a waste of your time. So I've got 5 top tips about avoiding the hard slog and the yawn, and they're basically, most of them are actually about selecting the right review to read in the first place. So if you're going to put the hard slog in, you might as well be reading one that's going to do the job for you. So my top tip number 1 is based on the fact that really you don't want a systematic review to read and you should be reading something else. The second is that the review you've got in front of you actually doesn't address the question you have, so that's also a waste of your time. The third problem is you've got a nagging feeling that the one you've got isn't worth your reading effort, so I've got a top tip on how to work out which ones are worth reading. My next problem is often, I think, well, particularly for clinicians, is it just takes a long time to work out if the one you've got in front of you is any good. So my top tip number 4 is about that. And the problem for many of us, of course, in terms of our confidence about what we should be reading, we really don't have a clue if we've actually thought about the right things to know if it's any good. So my top tip number 5 is about helping with that. So top tip number 1 is this question of, is a systematic review, and I've used the abbreviation SR here, is a systematic review what you really need or want? And so if you're thinking as a clinician, if you want an overview of something, for example, rehabilitation following total knee joint replacement, that's such a big, broad topic that really what you want is like a textbook chapter, which is essentially a descriptive or a narrative literature review that's actually written by an expert or a group of experts to give you that overview. Okay, so you possibly don't want a systematic review for that sort of reason. If you want an up-to-date summary of the evidence of the effectiveness of something, say constraint-induced therapy for upper limb function after stroke, that's the ideal sort of thing to find a systematic review for, particularly a systematic review of randomized trials, ideally with a meta-analysis. And the reason for that is that we consider randomized trials in many circumstances the gold standard for investigating effectiveness, not always, but often. And obviously a systematic review that collates all the trials on that topic potentially could give you a really up-to-date summary of the evidence of that. So that would be a good reason to read a systematic review. If you wanted something like an overarching understanding of the experiences of people with the lived experience of something, say vocational rehabilitation after an amputation, then what you really want is you might want a systematic review, but what you want is, because that question's about the experiences of people, what you really want is a systematic review of the qualitative literature. And so sometimes those are called qualitative systematic reviews, and sometimes they're called qualitative evidence syntheses. Okay, so in that case, actually, you might want a systematic review of that particular sort. If you wanted a summary of evidence-based recommendations for something, say clinical management and care of pediatric traumatic brain injury, actually what you want there probably, if you want summaries of evidence-based recommendations, so sort of general guidance about what's best practice in any area, something like a clinical practice guideline is probably better. They're often based on several systematic reviews. or something called an overview of reviews would probably be a better idea there. And for example, there are several overviews of reviews out there now. There's some really nice ones in the area of stroke by Alex Pollock and colleagues. My top tip number 2 is you really want to be looking for what you want, and you want to be looking for it efficiently, okay? And so there, I'm going to pick up the second element there first, which is about looking for what you want efficiently. There are some places that collect systematic reviews, and these are some of them, okay? And so if you're looking for a systematic review, it's not a bad idea to actually go to a place that tends to collect them. Now, the first one on the list there, Prospero, that's actually a register of systematic reviews. So researchers who are going to do systematic reviews register their review before they do it with Prospero. So you won't find the completed reviews there, but you'll find what people have intended to do, and then you can go looking for the final publication of it. Probably the biggest one on that list is the Cochrane database of systematic reviews, and these are, in Cochrane at least, typically reviews of effectiveness. Not always, but often. And the really great thing about Cochrane reviews is they tend to be top of the trees in terms of quality. They have very, very robust quality assurance processes. And the other great thing about Cochrane is that it's actually free in New Zealand, and the reason for that is our Ministry of Health pay for a New Zealand-wide license. So if you're logging into Cochrane from a New Zealand URL, you can access any Cochrane review in its full form. The last thing on the list there I've got is that actually a sensitive and specific search in an appropriate database can be as good as anything. However, the problem is that systematic reviews are called lots of different things. So there's the term systematic review, there's the term meta-analysis, which means something slightly different. So a meta-analysis is a pooling of numeric data. And some systematic reviews contain a meta-analysis, a pooling of numeric data, and some don't. So there's overlap between them because the numeric data in the meta-analysis come from a systematic review process, but you can get a systematic review without a meta-analysis in it. If you're wanting qualitative systematic review, it can sometimes be called a qualitative evidence synthesis. Equally, it can be called a meta-synthesis, or it can be called a meta-study, or it can be called a meta-ethnography, or a number of other things. Now, this makes it difficult to search sometimes if you're not aware that there are all these different names and different types of systematic review. If you're wanting a really, really good example of different systematic reviews, one with a meta-analysis, one as a qualitative evidence synthesis, and one overview of reviews, then the eSeminar video from yesterday that was presented by Joe Fidel has excellent examples of all of those three contained within it, so it's well worth a watch. So in terms of the searching thing, you might find it useful to know when you're searching what sort of review, systematic review, you're looking for. So systematic review, just as a term on its own, may not be quite what you're looking for in terms of what type of systematic review you're looking for. Are you looking for a systematic review, for example, of effectiveness? Are you looking for one about diagnostic test accuracy? Are you looking for one about prognosis? Are you looking for one about people's experiences? Okay, so the second paper there I've got on the stream by Munn and colleagues, this is a typology of systematic reviews that have different purposes. Finding out whether a treatment's effective, finding out about people's experiences, finding out about how common a disease is or a condition is, finding out what the prognosis of a condition is, and so on. The first one on that slide is actually about some of the different types of review. So not just systematic reviews, but reviews that are based on a systematic search And another type of review, a scoping review, a critical review, and so on. So sometimes when you're looking for a review, it's not necessarily a systematic review you're looking for. You're looking for one of the other types of review. So it's also worth knowing that if you're actually going to do an original search yourself. Saying that, the second part of my top tip about searching efficiently and knowing what you want, my second part of this top tip is actually to get some support from one of the University of Otago Wellington librarians. Okay, they're masters at this. They'll be awesome. They can do consultations and things over Zoom, so well worth being in contact with them to help you with this. And while you're enrolled, you might as well get their help so you can carry on following their top tips once you're not enrolled in a paper. There is an e-seminar video on database searching by Donna Titchens from the library. That was on Tuesday, and you might find that one useful to watch if you haven't already. One of the things I'd always recommend, though, if you're going to get in touch with one of the librarians, is that you get your question ready first, and this will help them a lot and it will help you a lot. So do some thinking about what sort of question you've got. Is it about the effectiveness of a treatment? Is it about the experiences of people? Is it about the prognosis of a condition? Because all those things will help you work out what the components of the question need to be, and that will help you find the right systematic review. A lot of questions are based around something you will have heard, which is this thing called PICO. P meaning population, I usually meaning intervention, C often meaning the comparator, what's the intervention being compared with, and O meaning outcomes. But that acronym PICO has been adapted and adapted and adapted. And you can see, for example, if you were interested in a systematic review of experiences, one of the adaptations of PICO is to mean population, phenomena of interest, like what is the experience of spinal cord injury, vocational rehabilitation following amputation, what's the phenomena of interest, and then the context. So it's worth doing some work on thinking what your question is before you get some help from a librarian. Now, my top tip number 3 is about this idea that you might be wasting your time reading what's in front of you. And I think what we all need is some top tests, really, for quality. What I think of as our yes-no criteria. This is worth reading or it's not worth reading. So I have 2 parts to my top tip about quick tests for quality. And the first of them is about whether the researchers who've done the systematic review have used a reporting standard to report the review that you see in front of you. Okay, now you will find if you read a Cochrane systematic review, they don't use a reporting standard, and the reason they don't is Cochrane has essentially a format which is really standardized. So there's no need for a Cochrane systematic reviewer to choose any of the other reporting standards because they use the Cochrane reporting standard, which, as I say, is very high quality. But there are other reporting standards out there because, of course, not all systematic reviews are Cochrane systematic reviews, and neither should they be, or they don't have to be. So, for example, probably the most commonly known reporting standard for systematic reviews with meta-analysis is called PRISMA. Okay. And the interesting thing about PRISMA is subsequent to its initial publication, lots of people have said, well, I can't spell reviews, I've just noticed. Systematic reviews, they vary a little bit depending on what it is that you're reviewing. So, for example, if we think about rehabilitation interventions, there are lots of interesting things about the complexity of rehabilitation interventions, for example, in comparison to a single dose of a single drug. And so, for example, there's a PRISMA extension for non-pharmacological studies or non-pharmacological systematic reviews, and that's because you might need a whole lot of extra things to think about because of the complexity of the intervention when you're reporting that sort of systematic review. So that one is typically, the PRISMA is particularly oriented to reports of reviews of effectiveness, which typically include randomized controlled trials. But for example, there's another reporting standard, which is this one called Enhancing Transparency in Reporting Synthesis of Qualitative Research, and its abbreviation is called NTREC. But actually, there are lots of different reporting standards. There are reporting standards for observational studies. There are reporting standards for systematic reviews of meta-ethnographies. So there's lots of different reporting standards. I've mentioned two of the main ones, but you can always do a Google search using reporting standard. I'm sure you know if you use the quotation marks around a search term in Google Scholar, you get that exact phrase, okay, and of words in that order. So if you put in reporting standard in quotation marks, and then in quotation marks something like systematic review or meta-ethnography or qualitative evidence synthesis or whatever the type of review is that you're looking for, then you're more likely to find a reporting standard for that type of review. The other great resource is this place called the Equator Network. The Equator Network brings together all sorts of different reporting standards. So it's sort of like a go-to site for reporting standards. So if you're looking for reporting standards, that's also a great place to go. And the second part of these, this set of tips on is the quick quality test, are these 4 questions from the Centre for Evidence-Based Medicine in Oxford. And what they say is, if you get an answer of no to any of these 4 questions, then just save yourself the bother. Okay, so the first question is, does the study address a clearly focused question? And this is using that framework that I've already discussed, such as PICO. Do you know who the population are? If it's a review of effectiveness, do you know what the intervention of interest is? Do you know what it's been compared with? And do you know what the outcome of interest is? If it was if you were interested in a review of people's experiences, then you'd be interested in the population and the phenomena of interest and the context. Okay, the second question the centre say is, did the study use valid methods to address the question? The third is, are those valid results important? So are they clinically important? Things can be statistically significant without being clinically important. And the fourth thing is, are those valid, important results applicable to your patient or your population? Now, I have got a bit of advice about this fourth one before I move on, and that is, start from the point of thinking, yes, they do apply, and then wonder within what constraints, or wonder with what caution. Okay. I think our tendency as clinicians is to start from the point of view of all patients are unique, and they are, so I absolutely understand that point of view. However, the problem is this: if you start from the point of view of the person I'm thinking about as unique, then you have to build a massive case to think about the results of the systematic review apply, because my unique patient was not in any of those studies. Okay, so my advice to you is to start from thinking, yes, it probably does apply, but what would be the cautions in terms of applying this? And actually, when you look at the types of people involved in the studies that have been summarized in a systematic review, you actually might decide that no, the systematic review doesn't include anyone like your patient or your population, and if it doesn't, fair enough, it doesn't apply. So let me give you a hypothetical case where we answer each of these 4 questions. So I was a clinician and my particular interest was bladder problems. So let's say I was interested in a systematic review with meta-analysis of randomized controlled trials about a schedule voiding regime of any sort, and whether that was better than standard care that didn't include a voiding regime in people following stroke, and things that this review tell me about are reduction in incontinence episodes and changes in incontinence-specific quality of life. So if I found a review like that, I could say, does the study address a clearly focus question? And my answer to that would be yes. I can see the population, people with stroke, okay, with incontinence, intervention, schedule voiding regime, comparator, standard care without any, and outcomes, incontinence episodes, and incontinence specific quality of life. So if I saw that information, say in the abstract to the systematic review, I'd think, yep, time to move on. Did the study use valid methods to address the question? Now I'm going to come back to that in a minute, because often I think that's the question we doubt our ability to assess. So I've got some more information about that one in just a minute. Okay. Are the valid results important? Well, typically as a clinician, I really don't have any difficulty making a judgment about that. So if this particular hypothetical systematic review told me that the reduction in incontinence episodes was 1 fewer incontinence episodes every 3 or 4 days, I'd say, well, bollocks to that. You know, the fact of the matter is most of the people that were involved in the studies that were included in the systematic review were leaking 4 or 5 times a day. And for the amount of burden of doing a scheduled voiding regime, is 1 fewer episodes, leakage episodes every 3 to 4 days worth it for them? I doubt it. So I'd say valid results important, might be valid results, but important clinically, I don't think so, not really. Then that fourth question, are the valid important results applicable to my patient or population? Well, I might be thinking about a particular patient who is leaking 4 or 5 times a day, and I think, no, definitely not. Okay, but let's have a little look at this thing that I think we often doubt our ability to answer, which is, did the study use valid methods to address the question? So my top tip number 4 is about fast assessment of valid methods. Okay, so this is the acronym. And these are sort of basic criteria, okay? So you really want to know that they found most of the studies that would be relevant to the question. In terms of the articles they included in the review, you want to know what's in and what's out and the quality of what's in, because one of the big criticisms of systematic review is garbage in, garbage out. Okay, so you want to know what's in. In terms of the synthesis, was there one? Okay, now one of the things that really frustrates the heck out of me as a reader is that when you just get a systematic review that says we found 5 studies, study 1 said this, study 2 said this, study 3 said this, study 4 found this, and study 5 observed that, and there's no synthesis. All it's done is describe 5 different studies. Okay, that is not a synthesis, and typically not very helpful, because it hasn't made something that's more than the sum of the parts. It hasn't drawn it together and said, what does this mean? Okay, so if it doesn't have a synthesis, either numeric or some genuine sort of narrative synthesis that goes a step better than description, I don't think it's worth it. And then T stands for together, which is, was it actually reasonable to put the data together in a synthesis? And this is particularly the case, I think, when we're talking about numeric pooling of data or a meta-analysis. You know, are they trying to compare apples and pears, or are they all just different sorts of apples that, you know, they're trying to bring together in the same basket? So I'm going to look at each of these in a little bit more detail with an example. So here's the example, and given our current situation here and around the world, I've chosen a very recent review, which is actually around rehabilitation interventions in a very high acuity environment, intensive care units, and whether rehabilitation interventions and intensive care units help people. So when I look at this systematic review report and start with my first question, does it have a clearly focused question? Well, I found it's an effectiveness review. It's about whether rehabilitation interventions affect clinical outcomes. So it's an effectiveness review. So my PICO question is population intervention comparator outcome. And I found all this information in the title of the paper or in the abstract, which was right there on the front page. So population is critically ill patients. The intervention is rehabilitation interventions, and the abstract tells me they were interested in 3 specific things: neuromuscular electrical stimulation, cycling exercises, or protocolized physical rehab. The comparator was standard care, and the clinical outcomes of it that they report on, for example, include things like mortality and ICU length of stay. So my immediate response in terms of fast, quick assessment, yes, worth reading on. So the next question is, are the methods valid? Finding the studies. Well, the PRISMA reporting standard for systematic reviews of randomized controlled trials says there should be a flowchart type diagram like the one that's on the screen here. Don't worry about the detail, it doesn't matter. That flowchart type of diagram we often call a PRISMA diagram when it appears in a systematic review. And what that diagram tells me is which databases they searched, the number of articles they found in each one, the numbers they screened, the numbers they included, and the numbers they excluded, including the reasons. So I know something about where they found these studies, and how comprehensive their search was and things. And so my immediate fast assessment is yes, I'd read on. Okay, the next one is about the articles themselves. Were they any good? And so the first thing I want to know is, did they have clear inclusion exclusion criteria for these articles? Do I know what sort of things they wanted in and what sort of things they were going to leave out? And so if I quickly scan this paper, under the methods section, I can see there's a subheading in there on eligibility criteria. That's a good sign. The title tells me the study type is randomized controlled trials, which is appropriate to an effectiveness review, so that's a good sign. And the PRISMA diagram shows me that there were exclusions and there were reasons for exclusions. And so my immediate quick sort of response is, yes, this is looking like there were article inclusion exclusion criteria that they used. Now the next bit about these articles and were they good articles was, were those articles chosen or assessed for their quality? So this is another criticism of systematic reviews. Each individual study has its own risk of bias. And then when you add lots of studies together or pull the data from lots of studies, what you can do is you can add a lot of bias together. Okay. So this is why we assess the quality of articles. Okay. So my first response was, uh-oh. So there was nothing I could see in the abstract. There was nothing I noticed in the subheadings and the methods about article quality. But then as I flicked through the paper, I noticed there was a figure 5. And the figure 5 title was Results of Risk of Bias Assessment. So that's another phrase that's used for assessing the quality of papers, is risk of bias assessment. And I could see straight away from this figure that they were assessing the sorts of things that are typically assessed about randomized controlled trials, like blinding to treatment allocation. So my immediate response is, yes, they must have done something, so worth reading on. Okay, so next question, what about the synthesis? Well, I saw that the methods had subheadings on summary measures and synthesis of results, so that was a good sign. And when I looked at the abstract, straight up, there's a heading there called data synthesis, and I could see that there were pooled numeric data. So they clearly did do a synthesis, and in this case, it was a meta-analysis. It was a numeric pooling of data. So my quick, fast assessment was, yes, move on. Might be worth reading further. And then the last part of fast, was it worth putting these things together? Was it a reasonable thing to put things together? So this comes down to the idea of homogeneity, whether things were similar enough or too different. And the word we use for that is heterogeneity. And there are 2 particular types. One of them is statistical, and one of them is clinical. Now, typically, when the researchers are clinicians, often what they decide in advance is that there are some things they're not going to put together. Some populations are too different from others, or some interventions are too different from others, and so that they just don't feel it makes clinical sense to try and pull the data from studies with those two different populations or those two different interventions. However, it isn't as clear cut as that, because you get people who are lumpers and people who are splitters. Okay, so for example, I've seen systematic reviews on interventions for neurological conditions, and the reviewers are prepared to put together traumatic brain injury, multiple sclerosis, stroke, motor neuron disease, etc., and they just say that intervention in any neurological population. Whereas other people would say, look, it makes absolutely no sense to put spinal cord injury together with traumatic brain injury for that intervention. It just doesn't make clinical sense. So they would split it out. Okay, so there's not a clear-cut line for anyone, whether it's a researcher or a clinician, about what you're prepared to put together and what you're not. I have to admit that I'm a lumper. I tend to put things together and then have a look, eyeball the results and say, do these look different or do they look similar? Isn't that interesting? The thing I did when I looked at this particular systematic review, just as a reader of it, was I looked at the methods and I could see that word heterogeneity popping up. It just came out and hit me between the eyes. Okay, so I looked under synthesis of results, that means putting things together, and the word heterogeneity popped out at me straight away. So my sense was these researchers had at least considered it. They had considered whether it was okay to put things together or not put things together. And because of that, that was enough for me to say, I'm prepared to read on. So this is my last top tip. And that is, once you get through all of those stages, particularly that FAST assessment, then if it's come through the FAST assessment with a yes to all those 4 questions, then I think it's worth going back for a really detailed read, okay, and really getting into what have they done, how have they done it, what did they find, what does it mean, what are the cautions. And to help me do that, I would definitely use one of the checklists that's around to support my detailed reading. Probably the most well-known of these is the Critical Appraisal Skills Program, okay, which is the one that's listed at the top there. The next 2, the one from the Centre for Evidence-Based Medicine and the one from Joanna Briggs Institute, these are interesting because their checklists actually come with sort of annotations. They tell you what you're looking for and where you're looking for it and what it might mean. So, you know, while you're getting into the swing of doing a detailed reading of a systematic review, you might find the sort of extra support that comes with the tools from Centre for Evidence-Based Medicine and JBI quite useful. The best bets one, to be honest, it looks very like the Critical Appraisal Skills one, so I put it there for completeness, but I have to admit I tend to use the one at the top, but then I'm very used to looking at Cochrane and other types of systematic reviews, and when I'm working with students who are less familiar with this, or clinicians who are less familiar with it, I often use the guidance that comes with the Centre for Evidence-Based Medicine and the JBI ones, because they have some very good explanations. Okay. Thank you very much for listening, guys. That's a quick yomp, or I hope I haven't made you yawn.
Can I just add one thing linked to the appraisal tool? So for the students in REHP 704, they've just reviewed some clinical guidelines, and they've used the Agree tool. Yeah. And it's really interesting that most people in their reflection talked about the value of the Agree tool to help them understand what was really going on in the guideline. Yes. So that the appraisal tools are really helpful especially as you're learning how to read
Yeah.
this sort of information,
Yeah.
to give you a really good idea of what's good quality and what to look for.
Yeah, I agree. That's one of the major advantages of them is that support. Yeah. Any questions at all that anybody's got? No. Well, we've done well. I would encourage you, if anything does occur to you, or you just didn't choose to ask here, do use the Padlet. I'll be keeping an eye on that, and very happy to answer any questions at all that people have got there. So thank you for your time this evening.
Thank you
so
for
much.
your attention.
That was
awesome.
Was that good? I hope
Thank
so.
you for keeping it in time.
I spoke very fast, I know.
It was awesome.
Ka kite to everybody.
Thanks. Bye.
Bye.